Well, it's a great privilege just to introduce you to a good friend of mine, which is Drew Gormley, who I've known for probably over 6 months now. And Drew runs an organization that is involved in early intervention prevention of suicides. And myself, my name is Matthew Easton, as you can see. I'm based here in the UK. My background is that I've worked with the Cabinet Office and with DWP around community development, and I work with probably over 600 different community groups in looking to meet the needs of local people through different social action and community development projects. I'm also involved in the area of high street rejuvenation and what does it look like to repurpose vacant spaces that, again, benefit people. My area of specialism is behavior change and enabling people to thrive. So that just gives you a wee bit of context of who I am. Suicide prevention is an area that I'm particularly interested in. As I say to various different people, unfortunately, I do have skin in the game, having had a friend of mine commit suicide about 10 years ago, and then even more close to home, my brother-in-law committed suicide about 6 years ago. And having seen the impact of mental health deterioration and the impact that it has afterwards to friends and family, the other area which then having conversations with Drew is then what is the more global impact of what suicide is. Interestingly, the thing about suicide is that it's not just about suicide, it's about mental health, and often it acutely goes into the area of self-harming or doing harm to ourselves or harm to others, which then obviously has a flow through into crime and domestic violence and all sorts of things like that. Statistically, we know that in 2008, when there was an economic crisis, the implications to an individual and communities, there was a spike of suicides, an increase in suicides about 4 years afterwards. And we, as across the globe, having had the pandemic and the impact of COVID, and then the consequences of dealing with the economic crisis for all sorts of different reasons, we know now that we are probably about 2 to 3 years. Just in 2 to 3 years' time, we will then see another increase in horrific decisions made by people, and we know that there are things that are happening now. I could go on a lot about that, but this is really very much an introduction to the work that Drew does, where the company, the context from where they come from, what they do, and more importantly, how that impacts local communities, that has enormous positive impacts that transforms lives. So, Drew, enough of my introduction. I'll pass it over to you.
Thank you, Matt. Appreciate that. And look, we're very much on the same wavelength when it comes to suicide being a symptom of something much deeper. So it's very much about community transformation. It's about understanding the underlying causes of suicide. We know that suicide is a symptom. It is there is a root cause to that. There are surface causes, then there are kind of root symptoms, root causes. We need to drill right down and get as early as possible as we can prior to those critical incidents. And look, just to give you a quick bit of history as to how we've arrived at where we are. We got some training about 11 years ago from an organisation called Living Works. It's in 25 countries, recognised by the WHO and UNESCO as being best practice internationally. We started training people because we found out what a huge issue suicide was in our local area. We trained quite a substantial number over about 18 months. But frankly, while it is admirable, it's very essential, it's very important. It's like trying to hold the tide back with a bucket. There are too many factors that you're not dealing with if you're just intervening rather than dealing with the root of why things are happening. So we then got funded by the federal government here in Australia to develop a suicide safety framework, which is a complete framework that you can implement in any group of people, organisation, geographic region. We delivered that in Australia and Malaysia with exceedingly positive results. But again, we were dealing with or developing a framework, not knowing exactly what the real-time information was. We went back to the government. They funded us to develop a piece of artificial intelligence software that identifies gaps in safety in communities, not risk. Anybody that has been involved in this field, being the field of dealing with, community welfare, those types of things, you can't mitigate risk. There's always going to be a risk you can't manage, you can't deal with, you can't preempt. So you've got to develop a framework of safety, resources, and support. And so what we were really doing with the AI that we developed over a period of about 5 years was identifying gaps in safety, addressing those gaps by producing a set of evidence-based findings and recommendations that can then empower local communities to take control of their own futures, rather than us always looking to a government that's under tremendous stress with limited resources and sort of perpetuating a welfare state. We're encouraging mutual aid across multiple groups, multiple organisations in community. And as we do that, we've seen some astounding results. We developed a relationship and a project that we delivered in the Upper Murray region of Victoria in Australia. The Upper Murray region had a suicide rate that was 10 times the national average. We were asked when we went there, what do we do? My research and development director made one of the smartest responses I've heard her make. She's a pretty smart girl, but this was smart, and she just said, we don't know. Because it's all very well and good throwing money and resources at stuff hoping it's going to work, but rather we need real-time data that is specific, it's measured, it's evidence-based, and produces that result so that we can then understand how to allocate resources effectively and empower local communities to take control of their own destiny, which is what they really want to do. That we've got we know in every area that we've worked, there's multiple agencies, multiple community groups, community-minded individuals and families, and they want to take control of their own futures, and we help them to do that. And we were gratified to hear over the last 22 months since we delivered our software and provided those findings to the community, to decision makers and to health department up in the Upper Murray, that there hasn't been another death. So our goal is to provide this the opportunity for the use of this AI wherever we go. And look, Matt, I think it's probably even more apt that rather than calling it the aggregate suicide safety assessment tool, that we call it a community wellness assessment tool, because we're really looking at a range of different pillars, if you like, to support understanding, real-time assessment of the complex contributing risk factors and safety gaps, so that we can really drill down, understand, and get a very good assessment of what a community is dealing with. The individual characteristics or pillars that we deal with are obviously mental health, help seeking and coping, relationships, hope, gratitude, and suicide thought. Those, coupled with the community pillars of social connection, social belonging, social cohesion, social hope, basic needs, and cultural safety and comfort, create a very comprehensive and measured, detailed report, which we run through the AI. We've got a database of 2,000 or so peer-reviewed publications that the AI draws findings and recommendations from. We're building on that all the time, and obviously each time we deliver the AI, we obtain more data, more information, and therefore our findings and recommendations become even more refined. We then provide that information at 3 levels to the general public, to decision makers and community groups, and then to people in government, people in the health department, people in mental health, and so on, so that the information is digested effectively by those different groups and they can act accordingly. So we are very enthusiastic about helping out wherever we can go when we know that we're onto something. We use AI as a tool, not as a control, and we want to use that knowledge and information simply by expediting the process of collecting, assessing, and making recommendations on the information. In the Upper Murray, for instance, we could have paid 6 psychologists for 18 months to collect the data, research it, formulate findings, formulate recommendations. We did that same job in 6 weeks for about 1/10 of the price. So our goal is a cost effect, but also expediting this process so people can get information now, not when it's already possibly 2 years old. So that's how we are delivering the AI.
That's amazing. And I think just to highlight a few things which really stand out to me is the fact that the Upper Murray region that you've given an example had a 10-fold proportionate to the rest of Australia of suicides. And as a consequence of the area, that the Upper Murray area, you've had 100% zero number of no one's committed suicide since.
To date, there hasn't been another death.
Right. So there's an economic and a social impact to that.
Absolutely.
And of course, there will be other optics around self-harming and then relationship breakdowns and so forth, which we can probably overlay. The purpose of this video really is to actually just a very quick snapshot. It's not a walk through the software. We've got another one for that. What we are looking to do here in the UK, most importantly, is just build, open up conversations and build working relationships to really to really start saying, well, can we support instead of shooting in the dark or wondering, well, how do we map? What do we do? I know that having worked with a lot of literally hundreds and hundreds of community groups who are saying we want to do something, but we don't know what to do. This gives the means to go about it in a much more specific way.
Yes.
So brilliant.
And Matt, one of the things that we discussed a bit earlier on today is the fact that you've got a whole bunch of agencies, different areas, they all need information. They need real-time, specific, detailed information. And this information, because it is so complex and detailed, it can provide resources and understanding to a whole range of different departments because we're drilling down at the root causes. And then the information is made available so that each and every area that needs clarity can then make some very clear strategic decisions. We feel quite strongly that the amount of data that we're getting, which is, to give you an idea, it's about 10 times what we get out of the national census in Australia.
Yep.
That from the data, it would be quite easy to develop a community wellness strategic plan that would be rolled out over between 5 and 10 years, and then perhaps make an assessment or a review every couple of years, make adjustments and keep moving forward. But I think the key is it's real-time data and it is specific to each unique area, because that's the problem. You can't blanket regions with the same thing because the demographics are different, their needs are different, and we need to be specific and personal when it comes to how we address those needs.
At the grassroots of this, it is a survey that's done in a population. What would you say is a sample survey or a pilot? And then what would be a live project? So once there was a pilot, what sort of sample would you need? And then if you were to choose a town or city, proportionately of that survey, bearing in mind the survey takes, 8 minutes, 10 minutes or so of a person's life.
Yeah.
How many people would make it worthwhile so that, let's say, town or city planners around whatever it be, health, social, employment, education, etc. What sort of sizes are we talking about?
So for a pilot, we would recommend perhaps 10,000 individuals. Yeah, that would give us, and we're looking at a survey response rate of around 15 to 20%.
Okay.
That's what we need. We did better than that in the Upper Murray simply because we developed very good working relationships and we had very strong community agreement. And we always reinforce that those are the first two things we want to get wherever we go.
Yeah.
So 10,000 would be ideal for a small pilot.
Mm-hmm.
But then, it's quite easy to cope with 500,000 or 1 million people in a particular delivery. We are very conscious that demographics, language, and also specific comprehension of what certain phrases and questions mean require us to adjust the way the questions are framed for each location.
Yeah.
For instance, we would be developing a range of questions specifically for the United Kingdom or England at least, and then we would consider different demographics in each location.
Yeah.
That allows us to ensure that we're getting the right data for each location rather than stuff that's more generic, if you like.
Yeah. And so once, let's say, a town or city agrees, yes, we want to run this program of the survey, the findings and recommendations, how long does it take from the moment of pressing the green button to go?
So for 10,000, we would get it all wrapped up in 3 months. So 12 weeks.
12 weeks. There you go.
Yeah, for 500,000, obviously. So when we are talking about these, we obviously are not including the fact that we would get good, strong agreement. We need a community agreement. We need understanding. We need the committee or the group, the working group, and those sorts of things. But once that is established,
mm-hmm.
for 500,000 or 1 million people, we'd get it all wrapped up mm-hmm. within 6 months. Yeah,
6 months, half a year. Great. That's really helpful. That's really helpful.
Well and truly within 6 months. Now, if an area, for instance, is if there is very good, strong community engagement across groups and a lot of community agreement with how to move forward prior to us commencing the process, we'd really be looking at 3 to 4 months. But developing that early agreement and getting consensus, getting everyone on the same page to us is critical. We think that's very important before we start. Yeah. Because we want to work in connection and not in competition. And provide support to the local people in each delivery that we provide. Yeah,
that's really helpful. Well, Drew, thanks so much for agreeing just to put this on record, as they say. And for those of you that are watching this, this will have been accompanied by an email. Please reach out. We are absolutely passionate to build working friendships and relationships because, as I said to one person, even if we just save one person's life, that's enough. But having seen that there are, I think about 6,000 or so just in last year committed suicide, and the cost to the public purse, and then the impact that it had to literally millions of people across the UK.
Yes.
This is no small piece of work. It's absolutely vital.
Thank you.